unexpected. So we're going to move right into the next session, Emerging Benefit Trends, Strategies for the New Normal. Aren't we all so familiar with talking about the new normal? So we are fortunate to have a great panel of 4 speakers who are going to provide us with tips for navigating this new normal that we all know so much about, as they discuss such topics including social determinants of health, mental health, which we know is so important, and also plan design options employers should consider. Our first speaker is Mike Cayley. He's National Account Sales Vice President in United Healthcare's Dallas office. Mike is responsible for developing new customer relationships through strengthening employer, broker, and consultant understanding of the United Healthcare value proposition. The second speaker is Chris Carlson, and he's Senior Vice President of Complex Health Solutions for United Healthcare. In his role, Chris is responsible for the strategy and development of capabilities related to consumer interactions and experiences across the service continuum to deliver superior health outcomes for the medically complex. Our third speaker in this session is Jennifer Kyle, who serves as Vice President of Product Development for the Complex Health Solutions team. Jennifer sets and supports strategic vision through program design and internal and external collaboration to ensure high quality and meaningful services that support individuals with complex health needs. And finally, our fourth speaker in this session is Dr. Nancy Mendelson, who is Chief Medical Officer of the Complex Health Solutions at United Healthcare, and is also a member of the United Health Group Medical Affairs Leadership Team. Her role encompasses clinical strategy, leadership, and execution in support of United Healthcare's complex health solutions. Welcome to our speakers, and it's all yours.
Great, thanks, Rebecca. We sure appreciate it. Looking forward to evaluating just a short video here that will introduce some of the concepts we want to transition from Norman and walk our way into a little bit different approach to talking about how to handle and best serve your complex populations. So Mark, you want to cue the video?
Rachel was born with cystic fibrosis and has recently undergone a bilateral lung transplant.
Before transplant, I couldn't even walk up the stairs. I can run a mile now, and I can take deep breaths when I run and keep going.
My name is Lenny Dean. I live in Fort Worth, Texas with my wife, Debbie, and my 2 children, Ryan and Rachel.
Our daughter, Rachel, was diagnosed with cystic fibrosis at 9 months of age. We knew that there would always be a lot of medical needs here.
With cystic fibrosis, you do have a lot of treatments, a lot of medicines that they go through throughout their entire life.
We have incurred a lot of doctor visits, medical bills, specialty treatments that we've had to go through.
As you can imagine, we have tremendous amounts of bills.
A lot of detailing that we had to keep tabs on.
It's almost impossible with the coding to know exactly what you're seeing. So when there's a billing issue, you don't know where the problem is. And it kept piling up, piling up.
It's one thing to fight for survival and go through a double lung transplant, and then to have collection people calling you and harassing you. That's not right. When these things are hanging over your head, there's such anxiety, and it creates so much more stress in the environment where it shouldn't be. It should be about taking care of your child.
It's very overwhelming.
Lenny was frustrated. He needed an advocate for Rachel and her medical conditions, and that's when I went to work. My name is Jody Nazi, and I'm a family advisor on the Special Needs Initiative team with United Healthcare. We help families who have children with special needs. We help them with benefits, claims, and social service contacts. With the Dean family, the problem was they were having some financial situations with claims.
In this one particular case, one of the medicines that Rachel gets on a daily basis, the billing got really messed up.
And I was able to address the situation.
She came to us at the perfect time and helped us just unbelievably.
To have someone tell me every week, hey, I knocked this out, this is done, this is done, this is done, this is done. It's like, it's unbelievable.
The healthcare system is extremely complex. I believe without us, these families wouldn't have an opportunity to get what they need, when they need it, how they need it.
The stress that she took away, you couldn't even put a dollar on it.
The relief in Lenny's voice was, amazing. For him to understand that he would have one point of contact at United Healthcare to answer any of his questions that he had was, I think, the best thing of all.
I consider her family for what she did.
My reaction when he says that is I want to cry. Right now.
She's welcome in my home anytime. She has touched our hearts, and I haven't even met her. When you said something, you meant it and did it. We're not used to that.
You just love working with the families and knowing I can help them. See, I'm crying again.
I would say to any mother or parent that has a special needs child or a situation, find a Jody. She has helped our lives to focus on Rachel.
I do feel I've made a difference in their lives. I'm here to help no matter what.
Well, I'm so glad we got to share that video with you today. Again, my name's Mike Haley. I'm a Sales Vice President for National Accounts with United Healthcare. And we wanted to provide a little bit of an introduction about some of the challenges that members bring to the table when they're trying to deal with chronic or significant health events, and thought it would be nice to show you Rachel, who's in our literal front yard here in Dallas-Fort Worth, somebody we've been able to help through our special needs initiative. And rather than continue a United Healthcare commercial, I thought I'd bring some experts to the table who really have a unique view on the types of challenges that significant or catastrophic cases bring to the member experience, and wanted to give you all in the employer community a chance to hear from our team that deals with some of the most vulnerable members in our population to talk about what they bring to the table when they have challenges, where we see particular barriers or things that pop up that you all can begin to plan around in your plan design or in your controls that might help to streamline things, make things easier. And I reflect on some of the things that Norman just visited with us about, in that 34% of the people in the survey responded that they had at least one member with a chronic condition. And even further back in our day, if we think back to the EBRI presentation, that 10% of the membership generates 70% of the cost. And so if we can be thinking about things from an employer's perspective about how we streamline and be thinking about the experience of those members who are significantly challenged, that I think it could give us a view on how we can create a new normal in the way that our plans serve the members that need us most. And so I thought I'd bring some folks along. We've been introduced already, but Chris Carlson, tell us a little bit, if you wouldn't mind, about how we find situations like Rachel's and what those families, some of the conditions that those families bring to the table when we finally get to interact and offer our assistance to them.
Yeah, Mike, thank you. Hopefully, can you hear me? Give me a nod.
Mm-hmm.
Terrific. Thank you for the question. And I always love the Dean video, and I love the fact that Lenny and Rachel and everybody are right there in Dallas, Fort Worth area. People who we find, and we find it in a rather unconventional way, typically what healthcare systems will look for is condition codes or indications that there's a clinical path that needs to be followed. For our members, the ones we work with day in and day out, 7 days a week, you actually have to look for the more chaotic data, algorithms that point out people who don't have a clear path, or people who have a very, very unique circumstance, or like in Rachel's case, or a rare condition, because those folks, they get lost in the system. Healthcare is not particularly good anymore at caring for really, really complicated individuals or individuals who have a rare or unique condition, be that if they're a child or an adult. And as the system has gotten more and more fragmented, you have to use new data and new methods in order to find the individuals and then get them to the right place. And often when we do get a hold of them, whether we call them or they call us, and we've developed capabilities that do that in a unique way, when we get that first conversation going, it's pretty clear that they have a ton of stuff between their care delivery process and their actual care seeking activity that's in the way. It could be an appeal. It could be they're not sure about coverage. It could be their diagnoses. They don't have a unified diagnosis, and they've got 3 or 4 different providers that are conflicting, and they don't quite have a cohesive diagnosis that they're working on together. It could be that the specialist they need is in another part of the country, or that their condition is so rare, there isn't really a clear understanding of how to treat it. And what that tells us, they have claim issues, they have service issues, they have appeals issues, all the things that can be sort of gum up the works in seeking healthcare are in motion for these folks, and really tenfold. And so we have to find them using really different methods and data analytics. And then when we do find them, and I think you heard this from Lenny in the video, the first thing you do is got to sort of clear out all the stuff in the way of them just focusing on their health. And that's always our primary concern with them, is just grabbing them and then making sure we clear out the debris from their life so they can focus on their health. Jen or Nancy, anything you'd like to add? Did I miss anything?
No, I mean, I think you hit it spot on, Chris. We are concentrating on helping the individuals that are the sickest, the most medically complex, and by concentrating on them, we feel like we can do the most amount of help.
Yeah.
Perfect. Yeah, I was curious to dive into that a little bit more completely. So, I think a lot of times we think about that there are procedural or process issues that people are coming to the table with, but can you tell me about the types of things about our system that overwhelm our most catastrophic or vulnerable members? Things that we may be putting in their way, that, maybe the baggage they bring to their insurance experience, if you will.
Yeah, I'll add a high-level response, and then I would invite Jen or Nancy to please sort of spend some more time on it. But the typical things you see to make sure people get the right care, premium designation and steerage and things like that, to make sure you're getting people to the right care, they just don't work the same way with the most complex individuals, because those sort of checks and balances that are largely based on provider and market dynamics they don't apply to the unique individual. For somebody with cystic fibrosis, there's a ton of things going on that aren't normal, and the things that we might put in place to make sure people are seeking proper care and getting it at the right quality level and from the right place to make sure their dollars are well spent. The rules change a bit. So in the most unique cases, you could sort of throw standards out the window. Things that we tend to rely on become challenging. Nancy or Jen, anything you want to add to that? I think there's some more there to offer.
I think Jen's trying to get off mute.
Yes, she is.
It's not working. I'll go ahead while she's trying to get off mute. Don't worry about it. I think there are many things. You know, the total cost to a family, emotionally, physically, financially, is one of the major strains, and trying to help families manage their fiscal complexities as well as the mental health complexities, and connecting them with the right resources, making sure they don't feel too isolated. Families in particular with rare diseases often don't know anybody else that's ever had a child with cystic fibrosis, and making sure that they're connected well and have resources to support them. Jen, did you get off mute?
With as much impact that I would think that a significant or catastrophic claim situation would have on the family, tell me a little bit about the mental health aspects and how we might help people navigate to really recognize that they may have an issue, or get them connected to resources, and really try and serve the entirety of the family as they deal with maybe one member's catastrophic or significant claim condition, really.
Yeah, I'm happy
Jen
to.
or Nancy, that one's best for you. Go ahead, Jen.
Yeah, thanks, Chris, and thanks for the technical assistance in getting myself off mute. It's an important question, particularly given the times that we're in with the compounding factors of the pandemic and the effects of the pandemic on people's mental health. We're seeing a significant amount of co-occurring depression and anxiety as it relates to the pandemic on individuals with complex needs. So figuring out how we best support them, acknowledge how hard things are right now, is really critical to the way in which we engage with individuals, whether it's a non-clinical engagement like we saw our expert Jody provide to the deans, or a clinical engagement, a family or an individual consumer talking to a member. We have to really think about listening to individuals in a way that's meaningful and not transactional, so that we can, make sure people know that they're being heard, and that we can then hopefully look within our walls of United Health Group or beyond to find the best resources and supports to help them manage those mental health challenges, or substance use disorder as well is a growing challenge as well. One of the interesting things I think that we've put in place for the complex members that we're wanting to serve is another sort of unique nuance support that takes on the aspects of mental health and behavioral health needs as well. And that's offering a spiritual support service. So it's a new it's a spiritual support, non-religious service that's provided by a chaplain who's on our team. And it really, it emulates the elements of a really important model of care in the palliative care world. And we're just really looking for new ways, innovative ways to support members. And it's quite unexpected when the consumer first hears about it from our team, but it has been incredibly well received and welcomed for those members who've been able to participate in that type of engagement.
Yeah, so it seems like anytime you can insert like bigger ears and little mouths, right? More listening skills and less talking, that you invite people into more of a personal relationship that I think is supported by the data that Norman was showing earlier, that people want to be heard, they want to be helped to a certain extent, particularly in the younger generations, and that the more we can come alongside them, the easier it is for us to guide them through other complicating parts of their care journey. Can you care to comment or expand on that at all?
Well, I think one of the most important things that we've done is each family is assigned a care advisor, like you saw in the video, and that care advisor is their main point of contact. So when they call in the phone number on the back of their card, they're assigned to a care advisor that is persistent and the same person as long as they have United Healthcare. And it's that uniqueness of not being shuffled around, and also ensuring that the families don't have to repeat their stories, so that they do feel heard and valued.
Perfect. Now, if I could steer it a little bit away from the UHC approach and some of what we're doing there, and more into some more practical things that employers can do with our last couple of minutes together here. I'm just curious if given all the experience and all in the times where we've been helped or assisted patients and members like this, are there things we think employers can do to better prepare members for a significant health event or for a catastrophic situation that might arm them better for handling the complexity that is in front of them?
You know, I'll start, Mike, and then I'll ask Nancy and then Jen to comment, because that's a big question. And I think even in the use case of Rachel, that particular family and their employer, what Lenny and Rachel and his wife and his son needed was someone to understand that they weren't struggling to engage with healthcare. Often employers or companies think that the member needs to engage more effectively. And the reality is the health system wasn't properly engaging with them. And that's really particularly common in complex and pediatric conditions. Rachel was a high school student, but at a much younger age, you know, so think newborn or 2, 3, 4 years, the healthcare system just doesn't really effectively engage. And so prepare your employers, prepare your teams to recognize that not every clinic and health system actually knows what to do. For many people in a very complex situation, there isn't a playbook. There isn't a condition-specific plan. And so if you think about how to engage effectively and where you need to engage, it isn't always I'm going to go to the doctor and they're going to tell me what to do solution. Sometimes you got to engage in a cultural way or in a community way, or with your health plan to understand how does the benefit structure support your best source in seeking care, because it can be adapted, and it needs to be adapted for these families.
Yeah, we were talking about that earlier as we prepared for our conversation today, and I immediately thought about, gosh, high deductible health plans, and again, I'm reflecting back to an earlier part of our conversation in this WebEx with DFWBGH that with the preponderance of those designs, it's really not the high deductible that is as big a concern. It's the behind the scenes access and the authorizations that become the barriers to creating the right kind of care model for these folks that you all serve. Can you expound on that a bit for me?
Yeah, well, these folks blow. Go ahead, Nancy.
Yeah, I mean, I think what I would add is that, you know, people with complex medical, similar to what Chris is saying, is people with complex medical issues or rare diseases don't always fit into your typical model, and they may need to see specialists. They may need to have access to different kind of testing or different places. And to realize that if we decrease the burden of their disease, if we decrease morbidity and mortality, which is what, of course, we all want to do for people, right? It's what physicians want, it's what employers want, it's what nurses want, it's what we all want. It does decrease cost, and it will get people back to work sooner. So if we can reduce the burden that these families have on every level, it facilitates what we all want in the long run.
Awesome. Well, I know we're all focused on trying to give people the best experience possible. I'm encouraged by having heard a little bit more about different things to consider, different issues around plan design or controls that may be creating obstacles for creating the right care paths for our members. And just want to offer some encouragement to the employer population out there that there are folks thinking about your members right now and thinking about how to remove barriers and how to make this work, not just for the cost savings elements of it. Certainly we want to do that, but because we're people serving people, and we want to create that crying at the patio table, feeling between in all the interactions that we're having. And so just want to offer you some encouragement, employers. We're thinking about you. We're thinking about your members, and would love to take, with the last couple of minutes here, any questions or comments that you all might have as we kind of ease you into your evening.
Well, I don't see any, this is Marianne, I don't see any questions in the chat box or the question box, but I really want to thank you, all of you, for speaking, for bringing home a major problem, and that is how do you solve all this? How do you make it easier? I think you said it, Dr. Mendelson. Reduce the burden of administrative things that go on behind the scenes that play out in patients and their families' lives, and focusing on the total cost, not just the cost of the actual healthcare itself, but on the financial, physical, and emotional side of it. I think that's, you bring up in a very humane perspective that, you know, we talk about eliminating low value care, and we talk about, you know, reducing costs here and there, we talk about this. And those are all things that we can do, that we can perceive. But when it comes to families that are suffering from a complex condition or special needs, wow, that their mental burden must be equally, and emotional burden must be equally as high as the illness itself. So I really thank you for bringing that kind of a perspective together here. And I'm happy to know that United Healthcare is working hard to pull all this together for us. It's,
yeah, I do see a question in the chat, Marianne. Somebody's asking, Chris, you may be a great person to answer this, is do we feel centers of excellence create or tear down barriers for employees?
You know, I have a perspective on that. So there's the official centers of excellence models that have kind of evolved over time. And I don't want to comment on those. We treat them differently, right? So we have unique relationships we've built up in each region, where when we cultivate and understand that someone's suffering from either they're on a diagnostic odyssey, meaning people don't know what's wrong, or they're on a treatment odyssey where they may have a really rare or complex condition where the treatment process isn't well understood. We spend time clinically understanding that case, engaging that family, and then shunting them essentially to the right place. And in that way, they're very effective at understanding how to really treat and take care of these really unique and rare situations. It's not a procedural center of excellence like you might see in an ortho space or a transplant surgery, right? That's sort of almost like a process opportunity where they're so good at what they do, it's unbelievable. You actually have to have this sort of relationship where you get the most complex, the people who are most curious and also most skilled to drive and use curiosity, knowledge, and experience to actually create an identification that no one else has been able to create. And in that way, centers of excellence, as we've established them, work beautifully. And I don't have a comment on the transplant part. I think those work well, but it's sort of like you have to bring, if you take them to academic centers have a different agenda. And so you have to have really a center of excellence model that focuses on bringing in the case and essentially tearing out all the assumptions that the healthcare system has built up over the years and doing a really holistic, really rapid interdisciplinary assessment, and then coming to a quick conclusion. And in many cases, our diagnostic odyssey cases are undiagnosed or misdiagnosed for 5 to 7, sometimes 8 years. And what used to take that long, we can now do in weeks because we've established these centers of excellence relationships. And I love that model. I think that's a very effective model.
Awesome. Awesome. Marianne?
Well, I don't have any other questions for you, and I think we've just hit the clock.
We hit the post.
Right on the chili. Yep. I want to thank you all for participating in our 4th session of our 16th Annual Benefits Forum. Thank you all.